Uh, we are going to practice the fourth part, my friends. Let's continue. This will be fourth video of MCh Entrance preparation. Radio sensitivity of tumors. Most radiosensitive ovarian tumor is dysgerminoma. Most radiosensitive brain tumor, medulloblastoma. Most sensitive radiosensitive testicular tumor, seminoma. Most radiosensitive lung tumor, small cell carcinoma. Most radiosensitive kidney tumor, Wilms tumor, and most radiosensitive bone tumor, wing sarcoma, and multiple myeloma. Group A, beta hemolytic streptococci, necrotizing fasciitis, treatment, urgent surgical debridement plus IV fluids plus broad spectrum IV antibiotics plus supportive treatment. Tertiary syphilis, gamma, neurosyphilis, Tabes dorsalis, aortitis, aortic insufficiency, coronary stenosis, nocturnal angioma. Let me see, Nocturnal angina. Angina. Abscess drainage. Hilton method protects underlying important vessels and nerves. Microaerophilic non-hemolytic streptococci causes maliny, gangrene. It takes only one. It's about 2 minutes, as expected. So 14 notes will be around 20 minutes. A little less or more. Right atrial contraction, A, okay. C, right ventricular contraction, when tricuspid valve bulges into right atrium. Now go to X and graph due to atrial diastole, filling of right atrium and tricuspid valve moves down. V, due to right atrial filling. Y, due to opening of tricuspid valve, emptying right atrium. Sarcoma, rare unusual neoplasm of soft tissue sarcoma, STS, most active chemotherapy against STS, doxorubicin and ifosfamide. Desmin and actine are most positive strains for lipomyosarcoma. Dermatofibrosarcoma, protuberance, imatinib, first choice. Trauma, triad of death, hypothermia, coagulopathy plus metabolic acidosis. Blunt thoracic trauma. Most common mortality causes tracheobronchial injuries. Pericardial tamponade, rapid accumulation of blood in pericardial space, muffled heart sound plus distended neck veins plus hypertension. Flail chest causes risk of developing pneumo or hemothorax traumatic. Burrs triad, rib fracture plus spine, pelvis fracture plus rupture of diaphragm. Boundaries of a triangle of safety. Lateral border of pectoralis major, lateral border of latissimus dorsi, line of fifth intercostal space, and base of axilla. In middle, I want to tell you all my doctor friends that correct pronunciation, correct phonetics is very important. But I guess I'm not very well prepared right now with phonetics of these major medical words as well. So sometimes my pronunciation doesn't resemble with American English. So please forgive me. And later, when I prepare more, then I will delete the same video and I will upload if I find I have made some improvement in reading and adding some more notes and pronunciation as well, okay? So right now, I guess you will get a dilemma in some pronunciation, but it's pretty sure that it's far better than zero. Means if there's no notes, then it's better than having no notes. Okay, so later I will make more and more improvements. So my friends, please let me know and comment me without any hesitation the problem that you find in this note and pronunciation and many more. Maybe my pronunciation is not very clear or something like that. Okay, I welcome all of you friends. Okay, we continue. Anti-HLA antibodies may cause hyperacute rejection. IV against cyclovir for treatment of CMV, PTLD post-transplant, lymphoproliferative disorder, treatment discontinuation of immunosuppression, antiviral therapy, radiation chemotherapy, antibody against CD20. First pancreas transplantation is done by Kelly and Lilly, 1996. Technique of sterilization, steam, surgical instruments. Ethylene oxide, her heart lung machine, hot air oven, glass syringe, test tube, flask, radiation, gamma rays, industrial packaging, paracetic acid, esterase, flexible, endoscopes, isopropyl, alcohol, clinical thermometer, beta propiolactone is fumigation of OT labs wards, secondary glutaraldehyde endoscope, autoclaving, culture media, suture materials. Next one. Gustatory sweating is treatment, antiperspirant, ALCL3 application, parotid fistula treatment, xylography, Newman and Seabrock's operation, granular treatment, surgical removal, marsupialization, most common structure injury in granular surgery, submandibular duct. Sjogren syndrome, right arthritis is most commonly associated. Female age 50 to 60, symptoms keratoconjunctivitis, xerostomia and carotid body tumor, chemodictoma. Turner syndrome is associated with cystic hygroma, bleomycin, OK. 432 piscibanil may eradicate cystic hygroma. Nasopharyngeal carcinoma treatment indication chemo 3 for sclerosis. Oh, let me see. What's that? Chemo, third and fourth stage, I guess. Okay, I'm not very clear because I have made mistake by writing so tiny letters. Well-established benefit of screening colorectal carcinoma, carcinoma cervix, carcinoma oral cavity, carcinoma breast. Pattern of calcification in breast disease, carcinoma, microcalcification, punctate branching, fibroadenoma, popcorn, coarse, granular, crest stone, fibrocystic disease, pylori, fat necrosis, curvilinear. Okay, Zika disease, recurrent periductal mastitis. Ossils, hernia through conjoint tendon defect just lateral to where it inserts with the rectus seat. Stammer's hernia, internal hernia occurring through window in transverse mesocolon after retrocolon gastrojejunostomy. Peterson's hernia under Rauch's limb after Rauch's NY gastric bypass. Valbo hernia front of femoral vessels, Holthius hernia, inguinal hernia with extension of the loop of intestine along inguinal ligament. Peptic ulcer disease to treat aspirate, amoxicillin, clarithromycin, and PPI is given for 7 to 14 days or combination of omeprazole, amoxicillin, metronidazole, alkaline phosphate, and gamma glutamate transpeptidase GZT are indicators of bile duct obstruction, Charcot's triad, pain, fever, jaundice. ELISA is a test for echinococcus antigen. Sequel of hepatitis seems to me gradual enlarge. Laminated membrane may calcify. Scolicidal agents 20% hypertonic saline, cetrimide solution, silver nitrate, formalin 95% alcohol, bevacizumab, and cetuximab. Treatment for stage 4 colon carcinoma. Continue. Okay. Vessels affected by aneurysm, arc of aorta, descending thoracic aorta or abdominal aorta, carotid, subclavian, axillary, femoral, and popliteal artery, small vessels, cerebral, mesenteric, splenic, and renal artery. Post-operative complications, hemorrhage, respiratory complications, post-operative renal failure, aortoduodenal fistula, spinal cord, ischemia, sexual dysfunction, infection, the 8th, 9th, and 10th. Intercostal nerves are seen running between the internal oblique and transverse abdominis muscles. Peptic perforation, post-operative management, cefotaxime 1 gram IV twice daily, amikacin 500 mg IV twice daily, metronidazole 500 mg IV thrice daily, IV ranitidine or omeprazole, laparoscopic appendectomy, infraumbilical 10 mm port for a telescope and camera, 5 mm port in right iliac fossa, 10 by 5 mm port in left iliac fossa or suprapubic area, long thoracic nerve, thoracodorsal nerve, cephalic vein, and axillary vein, structures preserved in radical mastectomy. Let's go for this. Make it bold. Boundaries of inguinal canal, external aponeurosis, anterior, rectus, anterior macus, fascia transversalis, posteriorly, medially by rectus sheath. Oh, gosh, I made a mistake. Sorry, dear. Sorry, dear doctors. I need to repeat it. Boundaries of inguinal canal, external aponeurosis, anteriorly, fascia transversalis, posteriorly. Oh gosh, I was totally confused. I'm so sorry. Boundaries of inguinal canal, external aponeurosis anteriorly, fascia transversalis posteriorly, and medially by rectus sheath. Sorry. Okay, I made several times mistakes. That is really unforgivable. Okay, boundaries of femoral ring, inguinal ligament, anterior fascia covering pectineus and cupetus ligament, medially concave margin of lacunar ligament, laterally septum separating the femoral vein, boundary of femoral triangle above base, inguinal ligament, laterally medial border by sartorius, medially medial border of adductor longus, apex medial border of adductor longus and sartorius, roof, skin, superficial fascia, and deep fascia of thigh floor, medial to lateral adductor longus pectineus, iliacus, and psoas muscles. Venous drainage of rectum and anal canal is 311, 7 o'clock position. Extrahepatic biliary tray is right, left. Hepatic ducts, common hepatic duct, gallbladder and cystic duct, common bile duct, and ampulla of bladder. Callus triangle boundary above by inferior surface of liver, below by cystic duct, medially by common hepatic duct. Okay. There's a picture. We have to look at it very carefully. Okay. First, I drew a rough diagram of our face, and then I drew the nerves. I just wrote numbers in it. Okay. In fact, it's copied from a very good textbook that we often use to learn and prepare for this high level exams. Okay, so now we are clear. 1 2 3 4 5 6 7 8 9 10 11 12 13 14 and 15. Okay, number one, ophthalmic. Okay, sorry, from ophthalmic nerve. Okay, first one is supratrochlear, 2 is supraorbital, 3 lacrimal, 4 infratrochlear, 5 external nasal from maxillary nerve, 6 okay, infraorbital, 7 zygomaticofacial, 8 zygomaticotemporal from cervical plexus, 12 greater auricular and 13 lesser occipital from cervical dorsal rami, 14 greater occipital, and 15 third occipital. Okay guys, so all the best, and see you in next video as soon as possible. Or did I miss something? Sorry guys, let me add it. To focus on the picture, I missed very important points. 9, 10, and 11 were missed. So there are from mandibular nerve. 9 is auriculotemporal, 10 buccal, and 11 mental. Okay, that's all for today. And my friends, we are going to see you again with the next video, okay, that will be coming part. So all the best for today. Have a good time, and see you again. Bye bye.